Hi, I'm Dr. Brian Kaufman, a retired family doctor, a CLL patient myself, and the co-founder, executive vice president, and the chief medical officer of the nonprofit CLL Society. Dr. Nabhan?
Chadi Nabhan. I'm Chief Medical Officer of Right, a generative AI company that is bringing AI into clinical research operations and clinical research and clinical trials. I'm a hematologist and a medical oncologist. I focused academically on lymphoid malignancies, and of course, CLL was a big part of my life.
And you're also an author who just wrote a book, The Cancer Journey, which is encyclopedic in its approach. And I'm going to pull out one chapter you wrote that's very dear to me on caring for the caregiver. And if you could give us a sense of why you dedicated a chapter to this and what's important you saw as a hematologist oncologist with the patient and their care partner in the room with you, if you could talk to us about that.
This is a very dear chapter to me as well, Brian. I think caregivers are the unsung heroes. And I think they sometimes get left by the wayside because physicians, they are focusing on the patient, but they forget that support system around the patient and what they may be going through. I also think there's a lot of emotional dynamics for the caregivers because they may be having a lot of issues, but they feel guilty bringing this up. Because if they come to me and they start complaining about what they're going through as caregivers, they will feel subconsciously they're diverting attention from the patient who is dealing with cancer or chemotherapy. And caregivers go through a lot of this because they sometimes forget themselves. And I worry about them getting into compassion fatigue or burnout because of all of this. I've seen that many times in my patients and families, and I've took it upon myself to actually sit down and talk to the caregiver and say, and just simply looking her or him in the eye and say, how are you doing? That just how are you doing? Just spend 2, 3 minutes sometimes. I know it's busy clinic. I know there are a lot of things happening. But patients with cancer are so gracious. If you're late on the next patients for 10 minutes, that patients that you are late for, they appreciate that because they know that when they need that 10 extra minutes from you in a future visit, you're going to give that to them. As long as you just tell them I'm running a bit late because there's a patient that needs me. Caregivers are very important because patients cannot go through the journey alone. They cannot. That could be a spouse, a partner, a kid, a grandkid, whatever it is, but you need someone with you. But that someone, in order for him or her to care for the patient, they need to be cared for. So I actually described several stories where I really noticed that the caregiver was having issues. And I try to the best of my ability to provide guide where the caregiver could try to step back, take care of herself, of himself, ask for help of family and friends, set some boundaries, and not to be shy about expressing what's going on. I think this is very critical. I saw it in my clinic way too often, and I felt it's very important to get an entire chapter for it.
And you actually give some practical tips to caregivers, give some very personal stories about caregivers who were struggling along the way. So yeah, I was very touched by that, and I can't emphasize enough the importance of a caregiver or a care partner or carer. There's different terms for it that on the CLL journey because it's a long journey, it's an emotional journey, and it's
And
for those.
it's gonna be filled with some bumps. That's really the key. It's not gonna be smooth. Look, a CLL patient could go for 5 years, let's say 6 years, without needing any therapy, and that's great. Then they may need therapy. The therapy may have some issues, some complications, some things like it may not work, it may work. You need somebody around with you. But I do think as a patient, you need that person. All I ask in this chapter, let's check on the well-being of that person who is taking care for the patient, of the patient. It is so important.
It's a great book. It's a great chapter in the book. Thank you so much for all you're doing.
Brian, thank you so much for having me, and I hope your constituents find value in the book.
Thanks very much.